Okay, move on. Next patient, Guillain-Barré. You should have a handout on that somewhere in the midst of your travels. Yes, no, maybe. Okay. Now, this one, look at the ventilator and color it, because it's what you got to know. Color it, put some marker on top of it, because that's what the hell's going to happen. They're going to be on that ventilator within 7 days. So they started off, when they started having whatever they're having, which is symmetrical paralysis. Look at the foot of the bed and look at what they're having. I tell you it's MS on crack. In other words, MS took 20 years to develop. This took 7 days. But it's the same shit. So essentially, they both have paresthesia, numbness, weakness. Let's say that was on Monday and Tuesday. By Wednesday, they're falling, crawling, and can't quite get it together. By Thursday, they can't walk. And they're not moving their arms very well either. By Friday, they can't talk. I mean, it just gets ridiculous. Within 7 days, they're on a ventilator. Okay? Now, why did that have to happen? Well, look at your handout. On the left-hand side, you should have something on there about a respiratory infection or intestinal infection, and hopefully you have something on there that says autoimmune and immunizations. Yes, no, maybe. Okay, so all of that's on there for real? Okay, that's a beautiful thing. Again, immunizations, and I know someone that this happened to. Respiratory illness or an intestinal infection. Those have been on your exam. So within a few days, your behind is on a daggone ventilator. Okay, so that's crazy. Okay. It is bilateral. All of these patients are immunosuppressed because steroids is usually part of their care. All of these patients are immunosuppressed. They have absent reflexes. Absent reflexes. It causes problems with everything. So almost every single cranial nerve will be affected. Almost every single cranial nerve will be affected, but there's no dementia. Diagnosis is done with a lumbar puncture, and it's very high in protein. Okay, turn the page. And the reason why I say that is because ALS is short and sweet. Here's ALS. This ALS, I'm going to tell you, all you had to know, it's kind of nice. Amyotrophic lateral sclerosis. Don't forget sclerosis. With Lou Gehrig's, which is the other name for it, you have a 2 to 3 year life expectancy. It is horrible. Now, so let's talk about this patient real quick. A student that went to Paula Rigoni, went to Tri-C, her next door neighbor of 30 some odd years, was at the picnic, and he was doing a little bit of jerking. That's it, just a little bit of jerking. And she said, what's going on with you, whatever his name is? He says, oh, I don't know. I've been doing that lately. She goes, nah, it's kind of fucked up. Go check that shit out, you know. So he went to the ER to try to figure out what's going on. He left out of the hospital after being there 3 days with the diagnosis of this crap. Died 2 years to the day. That's pretty much what we see. 2 to 3 years life expectancy. Caught everybody off guard. Now, your patient will, with these twitches, it'll be of the shoulder, the arms, the hands. This twitching business, it's called fasciculations. F-A-S, I'll write it up here. Fasciculations, twitches, fasciculations. That's what twitching is. Okay, it's crazy. It's the first sign. First sign.
This is for Lou Gehrig's.
ALS is Lou Gehrig's.
The hands and shoulders.
Twitching, just twitching. It's really weird. There is no dementia. You'll have your brain will work until the day you die. Patient's always on an NG tube. Basically full support. This would be hyperreflexia. Really high reflexes. Okay, done with that. Bell's palsy. Put really big, stupid big, outrageously big, 7th cranial nerve. Real big, make a big 7. You don't want to forget it. 7th cranial nerve. Put no straws. Chew on affected side. Chew on unaffected side. The patient will get better. This is one of the few things on the list that gets better. So my patient woke up to this. She was pregnant. Within 6 months, she was perfectly cured. Now, it's a tiny percent of people who don't get cured. One of them was a Tri-C graduate. Not only did she not get cured, so she had permanent Bell's palsy, but her husband committed suicide in the garage, hung himself. It was horrible. Put on your notes, self-limiting. Self-limiting means it's going to get better for most people. And it gets better really, really fast if you treat the patient with 2 things, steroids and acyclovir. So it gets better really fast within a few months if you early treat with steroids. And by the way, Decadron is a steroid, but that's not for this necessarily, but I'm just saying, I just thought about steroid. Okay, so steroids and acyclovir. Acyclovir, because this is a reactivation of herpes. That's written for you somewhere, I think. Do you see it?
Yep.
Okay.
On the left.
On the left at the top. Okay. Now, this is a patient with eye care. Look at the face and write eye care by it. This patient has to have eye care. Look at the face. Make sure you know that. So you got 2 patients that need eye care. You have myasthenia gravis and this patient, the Bell's palsy patient, that need eye care. Here's what we mean. If you don't give them eye care, then they're at risk for corneal abrasion, sort of like Graves' disease on the test. Corneal abrasion means that the sheets and blankets could scratch the cornea because their muscles are so weak, in particular this guy is paralyzed, that they cannot close their eyes completely. They're always a little open, okay, unilaterally, but still. So you need either patches over the eyes at night, or you need eye ointment or eye drops to keep the eyes lubricated, and you need eye drops, eye ointment.
We had a loose fitting.
What?
Because that's what I'm going to put on the thing. I put a patch, but it said a loose. She's like, if there's any part of the answer that's wrong, that I'm like, just totally fine.
Oh, that's not right.
She's like, because if it were loose,
It'll scratch the cornea.
Scratch them. I'm like,
Ooh, that sounds real horrible. But she's good though. Her students are very good. I get them. Okay, anyway, that's that. Highlight the butterfly, what is that called? Butterfly rash. Yeah. Highlight that butterfly rash. Go down there and highlight that renal failure and those kidneys. Highlight those lungs and the heart. So that's 4 body parts affected. Skin, kidneys, lungs, and heart, and that ain't even the beginning. The bottom line is this patient don't need to be nowhere in the sun. They need extremely good, effective sunscreen. There is no one test for this. There is no one test to diagnose this. It's a series of tests. They very often, if you can highlight it, have Raynaud's disease. This is very similar to scleroderma. So I'm going to have you write it on there. Scleroderma, I had it up here, but scleroderma is very similar to lupus. Both are autoimmune. Both of them, the number one cause of death is kidney failure, and both of them can have high blood pressure. Very similar to scleroderma. Both of them have Raynaud's. The difference with scleroderma is scleroderma has crest. Remember crest? Now, with lupus, no two lupus patients are alike. They're so different, they're all over the map with their presentation. It's usually Hispanic or African American women. There's a local celebrity that was my patient, Kim Sellers, that has this. And it's, not lupus, just MS. But it got worse. All these things can get worse if you get pregnant. So she has MS, but lupus and MS get worse when you get pregnant. If you look at the board, it has Plaquenil somewhere up there. Yep, Plaquenil. Matter of fact, you can write all of those down because they can be used for any autoimmune disease. So scleroderma could use those, psoriasis can use those, lupus can use those, Imuran, Cytoxan, methotrexate, Plaquenil, again, lupus, scleroderma, psoriasis, all of them can use that. Now, when it comes to lupus and Plaquenil, Plaquenil is an anti-malarial drug. Anti-malarial drug. And you have to get their eyes checked because it can cause vision problems. Plaquenil, vision problems, or muscle weakness. There is no one test, but there's a lot of tests that show up. So you have a positive ANA. You have a positive ESR, erythrocyte sedimentation rate. You have a positive rheumatoid factor, a positive RH factor. You have a positive, but it's falsely positive, syphilis. All kind of crazy stuff. "75% of all of these patients develop kidney failure. One of the number one causes for dialysis outside of hypertension and diabetes is lupus. We have an epidemic in our region of both lupus and MS. And again, this is autoimmune. Since Parkinson's is not on your test, use the Parkinson's handout for trigeminal neuralgia, because trigeminal neuralgia is on your test. And that's going to complete this chronic, chronic neuro. Okay, trigeminal neuralgia. What cranial nerve is this? This is how you're going to remember it. 5 fingers, slap the shit out of you. Oh my God, my face hurts. Oh, that's how you're going to remember it. 5 fingers. Oh, my face hurts so bad. It's only on one side. Oh, okay, you got to remember that. So this patient is going to have severe pain that starts at the mouth and goes up to the ear 100 times a day. Yeah, they're suicidal, trust me. They're depressed, they're suicidal, they lose weight, they don't eat because eating triggers all this pain, touching their face triggers the pain, brushing their teeth triggers the pain, putting on makeup triggers the pain, smiling triggers the pain, gum, all that shit, everything triggers the pain. And it's unilateral. I know, unilateral. I know. Oh my God. Now, this type of pain, we treat it with Tegretol. Oh, baby, I'm tired. Treat it with Tegretol, Baclofen. It's on the board. Neurontin. What's the other word for Neurontin? Gabapentin. Lyrica, which is Pregvalin. Lyrica. So again, Lyrica, Neurontin, or gabapentin, Dilantin, Tegretol, Baclofen. Every drug I just mentioned can also treat Guillain-Barré because they're in pain too. All these drugs treat pretty much any neuro. Okay, now don't touch the patient's face. Even though fan in their face will do it. It will trigger it. Serve food room temperature, not too hot, not too cold. Soft, mechanical soft diet, high protein, high calories. High protein, high calories. Okay, CAT scan versus MRI. Just remember with the CAT scan, you need contrast dyes, and you have to check for an allergy to what? Shellfish. Remember that with contrast dyes, the patient will have the sensation, even though it's not true, that they suddenly wet their pants. And the feeling will go from here all the way to their butt. So they're going to get hot, flushed, and feel like fluid was poured in the hot fluid, warm, was poured all the way down and set right in your butt. That's contrast dye with the CAT scan. Hold the metformin 48 hours before, 48 hours after contrast dye. For a CAT scan with contrast, you need an IV. Does everybody get contrast when they have a CAT scan? Not at all. But if you do, you need an IV. MRI, you have to check for metal. Sometimes that metal is in the form of what we call shrapnel. Shrapnel is pieces of metal. Our veterans have IEDs, meaning bombs, that they've walked on or drove over, the pieces of metal in their body. Day from down the way got bullets. So either way, you gotta check. All right, PET, positron emissions test. Positron emissions test. We use it in the workup of multiple sclerosis, and we use it for the workup of metastasis from cancer. You didn't have to do anything preparation-wise. It is going to be an IV. It is a nuclear test, and it shows the uptake of glucose. The uptake of glucose. You okay with this, y'all? Y'all done? You done? Okay. Done with that. No more neuro, no more cardio. Get this shit out of here. Positron emissions test. It works by causing an uptake of glucose because cancer likes sugar and so does your brain. So you'll see the plaques on MS patients.